Hi students, welcome to the video session on the father of plastic surgery. The father of plastic surgery is a biography of the renowned Indian surgeon and medical practitioner Susruta and his contributions to medical science. The text begins by informing the reader about the advances in science in ancient India. It then introduces us to a book called Susruta Samhita, which contains the teachings of the man himself. Susruta believed that practical experience was paramount and hence insisted that his students hone their skills by actually performing operations. For example, his students practiced making incisions and performed extractions on wax shapes, fruits and dead bodies of animals, and in some cases even humans. Apart from being a skilled surgeon and an inventive teacher, Susruta was also a master designer of surgical instruments. The instruments he designed and used had to meet the high standards and strict specifications laid down by him. However, Susruta is most popular for his ability to repair and even replace damaged noses. This technique of his is remarkable because even today remains popular. We now recognize it as the form of plastic surgery. The text presents Susruta as a brilliant, creative surgeon who pioneered several surgical techniques and methods and also found ways to help his students practice perfect them. It describes the technical details of Susruta's trade in language that is simple and easy to understand. By way of this biography, the reader becomes acquainted with the genius that was Susruta and is also able to marvel at and take pride in the technological advances in the subcontinent at that time. Let us read the lesson.
As far back as 400 BC, Indian surgeons were famous for their skill in performing all kinds of operations. They could remove cataracts from blind eyes. They could operate on the intestines. They were experts in plastic surgery and could actually give people new noses by removing some skin from their cheeks and joining it to the nose. We know about surgery in ancient India from the Susruta Samhita. This book, written in Sanskrit, contains the teachings of a remarkable man, Susruta. In fact, Arabian, Persian, and Latin translations of the Susruta Samhita helped countries all over Europe and West Asia to train skillful doctors. However, Susruta and the doctors of his time thought that book learning was of very little use by itself. In order to be good surgeons, they needed to learn by actually performing operations. This was not easy. Not many people were willing to let a surgeon try various operations on their bodies. So the young doctors thought of other ways. We could learn the art of cutting through flesh by molding wax on wooden boards, said one, or on cucumbers, gourds, watermelons, and other soft fruit, suggested others. Their knives cut skillfully through the wax shapes and fruits that had been covered with wax. Susruta told them, "You can learn how to tie good bandages by working on the bodies of life-size dolls stuffed with linen. Practice stitches on leather and cloth." Susruta showed them a clever way of learning how to extract teeth. The student doctors practiced first by drawing out seeds from thick jackfruit pulp and later by pulling out teeth from the jaws of dead animals. Susruta described the art of tying up a torn earlobe. It should be practiced, he said, by binding the broken stem of a lotus lily. He demonstrated how the art of cleaning small passages could be practiced on rotten wood. Sushruta was the first to insist that students of surgery must practice on dead bodies. At that time, a lot of people thought that this was an evil thing to do, but Sushruta said that there was no other way. Without practice, a surgeon with only book knowledge is like a bird that cannot fly because it has only one wing. As the ancient surgeons were also priests, they could study the various parts of bodies of animals that had been used for the great sacrifices. Not only was Sushruta a great surgeon and teacher, he was also an excellent designer of surgical instruments. He created over 100 instruments, but he said, a surgeon's best instruments are his own two hands. The instruments which he designed for pulling out thorns, splinters, and arrowheads resembled the mouths of various animals. He designed saws for amputation and even surgical needles. All the instruments were made of steel, and Sushruta said that they should be so sharp that they could split a hair in two. Among other things, this amazing man wrote about the importance of bandaging wounds. He warned that uncovered wounds would be attacked by gnats and flies and irritated by sweat and dust. Sushruta believed that doctors should use their skills for the good of people and look after their patients as if they were their own children. One of the most amazing operations which Sushruta taught his students to perform was replacing a nose that had been cut off. This sort of thing happened when there were wars. Sushruta Samhita describes this operation in great detail and goes on to tell the surgeon what kind of medicines and diet the patient should have. It was perhaps the beginning of what we now call plastic surgery.
Now let us go through the word meanings. Surgeons, doctors who perform operations. Cataracts, clouding of the lens in the eye. Plastic surgery, an operation by which someone's face or body that has been damaged or burned can be repaired. Molding, shaping. Linen, coarse cotton cloth. Extract, remove. Demonstrated, showed how something was done. Sacrifices, offerings made for religious purposes. Splinters, a small thin sharp piece of wood or similar material. Amputation, removal of an infected or diseased limb by a doctor. Gnats, small flying insects. Students, keep reading the lesson. Learn the word meanings. Thank you for learning along. Thank you and have a great day.